I think dentists have it right that more than the physicians do. We're about preventative care. We're not treating, we do treat disease, but we are really into preventing disease. The Surgeon General has come out and said, if you don't have good dental health, you don't have good health.
It's been unfortunate that there's been a disconnect between medicine and dentistry, thinking that, and it's underestimated that the digestive system, the health of the entire body starts with the mouth.
Correct.
The ability to chew, the ability to begin the process of breaking down the food begins in the mouth.
Correct.
Saliva has all these components, the enzymes, everything that goes with it to help the stomach digest. Okay, we're not gonna get into
this was before all that.
because-
But what I'd like to indicate is that you think you're having a full night's sleep.
Yeah.
And you're not.
Uh-huh.
And because when you clench and when you grind at night, you are waking yourself up. Therefore, what is sleep for? To restore your cells. It helps all the cells in your body try to recover and restore themselves, right? When you're not getting into that deep sleep, that restorative sleep, and you're staying in the upper levels of sleep and not getting that deep delta wave sleep that you need, you're not recovering. And what does that do over years and years and years?
Because
you're more susceptible to autoimmune diseases. You're more susceptible to cancer. You're more susceptible to all these things because sleep is the key.
Yeah.
And so I try to, and I'm sure you're doing the same thing, trying to explain to patients why it's so important that if you're grinding your teeth, you are not sleeping.
Here's how.
And they don't understand because a lot of insurance companies are not paying in either. But I tell patients, if you want to save money, you rather have a root canal after a root canal after a root canal and a crown and a build-up.
And possibly losing the crown. And possibly losing the crown.
Well,
I had a patient who clenched so bad, he actually destroyed 4 of his teeth. The vertical fractures, I had to pull out 4 back teeth. Vertical fractures, meaning that the teeth were vertically split in half from how strong. People don't realize people can pull trains with their teeth. Yeah. We have seen this. That's how strong the jaw muscles are.
Well, it's what a person is capable of doing when they're asleep is fascinating because the fail-safes that individuals have when they're awake, the reflexive action of being able to, when you're eating and something hard gets between the teeth, you don't even think about it. Oh, stop chewing.
No,
Let's
it's
open
automatic.
our mouth. It happens automatically, but guess what? At night, that's all off. The protective mechanisms are gone. And I've noticed, and I'm sure you have too, you have seen when we do the analysis for whatever may be needed, if it's a disorder, somebody's presenting in pain, whatever, and that people, casually, commonly call it, oh, I have TMJ. And what I tell people is, I sure hope you have a TMJ. I hope you have two of them.
TMJ.
Yeah.
Because that means temporomandibular joints. Those two
it's not
joints.
The disorder.
Disorder
is what they're
it
worried
helps
about.
keep our lower jaw in place and allow mobility. So it's a great to have 2 of them.
Yes.
But having said that, you can have disorders. They fall into many categories. But the most common one, obviously, is muscular-related overfunctioning of the muscles. And during waking hours, I look at the models that we have set up in the laboratory, and I try to look at the patterns, and I look at the patient. And you see these wear facets that can only come from tooth-to-tooth contact, the wear between 2 teeth, and yet while they're awake, you can't get them to contact it. Right? But then I ask them, bite as hard as you can, like abnormally hard. and then it starts getting closer. And they still won't be able to touch it because it's uncomfortable.
Right.
But then all of a sudden you see how they can twist the jaw to make things contact. The teeth are somewhat mobile. They have ligaments that can feel, and that's why that sensory ability protects the teeth, right? But when you're asleep, all bets are
I
off.
hope my producer can.
And what I find amazing is, Dr. Yacaman sees people that have been sent to her because of the thought that these people need root canals, right? Because the tooth hurts or teeth hurt. When in fact, it's the ligament that hurts.
And sometimes can be because of bacteria like this, but if it's not on the nerve, we can save it. But sometimes it's like this, and all the inflammation around is what giving you.
What I like to tell patients, to make it as simplistic as possible, the ligament is sort of in between the bone and the root of the tooth. Imagine the ligament being like your shock absorber. So if you have a shock absorber, so when you go over a bump, you don't like smash your head against the bottom of the car or the top of the car. So the same thing with the ligament. When you're chewing, your teeth can move a little bit, and they're the shock absorbers, so you're not destroying the bone of your jaw.
And like getting tennis elbow, your elbow can hurt. Well, that's how your teeth can hurt. But people don't think of the teeth as having a joint, because in a way, that ligament, but the teeth themselves also have that interposed connection between the root and the bone, because people don't think about it, but you don't want bone directly connecting with the tooth. So that ligament has sensory capability. It allows for mobility when it needs to, like you said, shock absorber. But it can be excessive where it starts to hurt, like when you get a tennis elbow.
Right.
But it's easier to deal with a aching joint than it is to be dealing with an aching tooth, an aching ligament, because people keep chewing, people keep clenching and grinding. So that's a harder one, and that's where you need compliance when you're using a guard. But what I wanted to bounce to real quick was, because you were touching earlier on the medical side of things and how we try to communicate to people and get their attention. I'll tell them on a regular basis. I said, would you want a heart attack? Do you want a heart attack at night? No, what? I said, do you want to have a stroke and have a stroke at night? I said, that's ultimately when we tie this clenching, grinding, and sleep disorders and extend it to apnea that you were mentioning about yourself, those periods that you were waking up, so it's understood that that's your body telling you that you've stopped breathing and you're dying.
Yeah, absolutely.
You're stressing your organ systems because the oxygen level is getting so low that the brain is saying, look, I'm dying. The rest of you is dying. Wake up or you're going to the pearly gates.
Or sleep apnea. They stop breathing, and sometimes they just...
it's multiple, like you said, you had like 34...
Micro wake-ups. I had some apneic events too. And there are guards that are specific for apneic events that we can reposition the jaw to an area so that your pharynx is open and you can breathe normally. So there is possibilities. But what I'd like to also touch on is, when they get to the point, and I tell this to patients all the time, they're like, well, just pull out the tooth. And just pull them all out. I'll just get dentures. And I said, that's like you telling your doctor, cut off both my legs.
Exactly.
I'll just use a wheelchair.
Yeah.
Cut off my legs. Don't you feel that teeth are like, if you don't have teeth, it's like losing both your legs. Yeah. To me, it's a prosthesis, right? A fake leg is, to me, they don't understand how bad it is when you don't have your teeth. You don't eat as well.
I tell them, like, you're gonna be like you're missing in a leg, like when you're shorter in one leg, because everything is this. The other teeth are gonna move. The upper is gonna go down. They don't know how many changes.
Well, I think there's to be fair all the way around, there's a responsibility on our part collectively
Yes.
within the dental profession to stress the importance of their future.
Yes.
And I guess in a hectic world, people wanted to get in and out. I have to get back to work, and I get it. There are factors, but somehow it has to be squeezed in there to not just address the current problem. Oh, I need a filling. Because why do you need a filling? Well, we can deal with the fact that it's diet, right? In this day and age of fast food, I'm sure you're overburdened trying to point out and evaluate diet. What are they drinking? Is the person eating a lot of power bars? These energy drinks.
The juicing, the heavy
Oh,
juicing.
it's
With all the lemon, I mean, how many people are like, well, I have lemon juice every morning.
acidic
Acid,
levels.
yeah.
It's
I drink coffee,
fascinating.
1 cup of coffee all day long for
Yeah.
50, like more than 50 minutes. They're just sipping their coffee.
They
And
don't
all that
eat.
acid is in their mouth for hours.
So,
Yeah.
in this, and then they wonder why they get sensitive along the gum line. Oh, I can't touch it. Oh, it's hard for me to brush. Or they come in for a cleaning or a checkup, and you go and, oh, don't touch that because that hurts like crazy. Well, why? Okay, and the thing is, you try to educate them. Now, if it's up to the person, then to follow through. But you're talking about prevention. So every opportunity you get, we should be trying to give them this information. And hopefully if you hear it over and over again, it'll start to sink in.
Right.
But at the end of it, just like when I said before, we help patients. I see them typically later in life. And when someone thinks that, and it gets presented, you hear it all the time. Oh, my teeth are terrible, and in no time I had all these implants and these new teeth. But those teeth are never like the originals. There is no implant on this planet that's ever as good as the one that was naturally there originally.
Yeah.
I know that it's prosthetic. An implant's a wonderful thing. A crown is a great thing.
Yes.
But it's not something you want to cavalierly go into. You should only be there because you need to. And I would give anything for people to try to understand clearly that it's like, okay, maybe somebody has 32 teeth. If they have enough space, they have the wisdom teeth too. But most people typically will start out with 28. So 28 teeth. I think, I'm to 27. Who cares? As long as it's not in the front, I don't care. And that's why I see a lot of cycles like that, where people just figure they're sacrificial. And then when everything else hits the fan, and now they're compromised, now they want a replacement, but it's never going to be as before.
Yeah.
And that's why I try to stress to them so much that the importance of watch what you eat. Look at the sugar content.
Right.
Be cognizant of the pH of what you're eating and drinking. I mean, alkaline water, hey, fine, okay. It's not acidic, that's okay.
Yeah.
But when they put these natural flavors, as you mentioned, anything that could add acid to it, it's a dangerous thing over time.